Ozempic is a prescription medication that is primarily used to help manage type 2 diabetes in adults. It belongs to a class of drugs known as GLP-1 receptor agonists, which work by mimicking a natural hormone in the body called glucagon-like peptide 1. This hormone plays a key role in regulating blood sugar levels. Ozempic is not insulin, but it helps the body use insulin more effectively. In recent years, Ozempic has also gained attention for its effects on weight loss, although its main approved purpose remains blood sugar control for people with diabetes. The active ingredient in Ozempic is semaglutide, a compound designed to act like the GLP-1 hormone that the body naturally produces after eating. GLP-1 helps signal the pancreas to release insulin when blood sugar levels are high. At the same time, it reduces the release of glucagon, a hormone that raises blood sugar. By balancing these two processes, Ozempic helps keep blood glucose levels within a healthier range. This dual action makes it especially useful for people whose bodies struggle to regulate sugar levels on their own. Ozempic is typically administered as a once-weekly injection under the skin, usually in the abdomen, thigh, or upper arm. The convenience of weekly dosing is one reason many patients prefer it over medications that require daily injections. The dose is usually started low and gradually increased over time. This slow increase helps the body adjust and reduces the likelihood of side effects. Because Ozempic is long-acting, it stays active in the body for several days, providing steady blood sugar control throughout the week. One of the most important ways Ozempic works is by slowing down how quickly food leaves the stomach. This process is known as delayed gastric emptying. When food moves more slowly through the digestive system, glucose enters the bloodstream at a slower and more controlled pace. This helps prevent sudden spikes in blood sugar after meals. As a result, people taking Ozempic often experience more stable energy levels and fewer extreme highs and lows in blood glucose throughout the day. Another key effect of Ozempic is its impact on appetite and hunger signals in the brain. The GLP-1 hormone interacts with areas of the brain that control hunger and fullness. By activating these pathways, Ozempic helps people feel full sooner and stay full longer after eating. This reduced appetite can lead to lower calorie intake without the feeling of constant hunger. For many patients, this effect contributes not only to better blood sugar control but also to gradual and sustained weight loss over time. Weight loss associated with Ozempic has made it widely discussed beyond diabetes treatment. While Ozempic is not officially approved solely as a weight loss drug, many people with type 2 diabetes notice significant reductions in body weight. This happens because of a combination of reduced appetite, improved portion control, and better blood sugar regulation. Losing excess weight can further improve insulin sensitivity, creating a positive cycle that supports overall metabolic health and reduces the risk of diabetes-related complications. Ozempic also has benefits for heart health, which is especially important for people with type 2 diabetes. Studies have shown that semaglutide can lower the risk of major cardiovascular events such as heart attack and stroke in certain high-risk patients. Improved blood sugar control, weight loss, and reduced inflammation all contribute to these protective effects. Because heart disease is one of the leading causes of complications and death in people with diabetes, this added benefit makes Ozempic a valuable treatment option. Like all medications, Ozempic can cause side effects, especially when treatment begins. The most common side effects include nausea, vomiting, diarrhea, constipation, and stomach discomfort. These symptoms usually occur because the digestive system is adjusting to slower stomach emptying. In most cases, side effects are mild to moderate and improve over time. Starting with a low dose and increasing it gradually helps minimize discomfort and allows the body to adapt more comfortably to the medication. Some people may experience more serious side effects, although these are less common. These can include severe stomach pain, signs of pancreatitis, or allergic reactions. Ozempic also carries a warning related to thyroid tumors observed in animal studies, although this risk has not been clearly confirmed in humans. Because of these potential risks, Ozempic may not be suitable for everyone. It is important for patients to discuss their full medical history with a healthcare provider before starting treatment. Ozempic is not recommended for people with type 1 diabetes or for treating diabetic ketoacidosis. It works by enhancing the body's natural insulin response, which is not effective in type 1 diabetes where insulin production is absent. Additionally, Ozempic should not replace insulin therapy when insulin is required. Instead, it is often used alongside other diabetes medications, such as metformin, to create a more comprehensive blood sugar management plan tailored to the patient's needs. Consistency is key when using Ozempic. Because it is taken once a week, choosing the same day each week helps maintain steady medication levels in the body. If a dose is missed, it can usually be taken within a specific time window, depending on how close it is to the next scheduled dose. Following the prescribed schedule and dosage instructions is essential for achieving the best results and avoiding unnecessary side effects or fluctuations in blood sugar control. Lifestyle changes play an important role alongside Ozempic treatment. While the medication is effective on its own, its benefits are greatly enhanced when combined with a balanced diet and regular physical activity. Healthy eating helps stabilize blood sugar, while exercise improves insulin sensitivity and cardiovascular health. Ozempic should be seen as a supportive tool rather than a standalone solution. Long-term success depends on building sustainable habits that support overall health and well-being. Many patients notice improvements in their blood sugar readings within the first few weeks of starting Ozempic. However, the full effects, including weight changes, may take several months to become noticeable. This gradual progress is normal and often leads to more sustainable results. Regular monitoring of blood glucose levels and routine follow-ups with a healthcare provider help ensure the medication is working effectively and allow adjustments to be made if needed. Ozempic has also changed the conversation around diabetes treatment by highlighting the role of hormones in metabolism. Instead of focusing only on insulin, medications like Ozempic address multiple pathways involved in blood sugar control, appetite, and digestion. This more holistic approach reflects a growing understanding of diabetes as a complex metabolic condition. As research continues, GLP-1 receptor agonists are likely to play an even larger role in future treatment strategies. It is important to store and handle Ozempic properly to maintain its effectiveness. Unused pens should be kept refrigerated, while pens in use can usually be stored at room temperature for a limited time. The medication should be protected from extreme heat and light. Using the injection correctly and safely disposing of needles reduces the risk of infection or injury. Patients are often trained by healthcare professionals to ensure proper use from the start. Cost and access can be a concern for some patients considering Ozempic. It can be expensive without insurance coverage, and availability may vary by region. Some insurance plans cover it for diabetes management, while coverage for off-label weight use may be limited. Patient assistance programs or manufacturer savings cards may help reduce costs. Discussing financial concerns openly with a healthcare provider or pharmacist can help identify affordable options. Ozempic is not a quick fix, but rather a long-term treatment option designed to support better metabolic health. Its effectiveness depends on regular use, lifestyle support, and ongoing medical supervision. When used correctly, it can help people gain better control over their diabetes, reduce health risks, and improve quality of life. Understanding how it works empowers patients to make informed decisions and take an active role in managing their condition. In summary, Ozempic is a powerful medication that works by mimicking a natural hormone to regulate blood sugar, reduce appetite, slow digestion, and support weight loss. Its once-weekly dosing and additional heart health benefits make it an appealing option for many people with type 2 diabetes. While it may not be suitable for everyone, it represents a significant advancement in diabetes care. With proper guidance and commitment, Ozempic can be an effective part of a comprehensive health management plan. Follow MD Pharma for more.